You're listening to the Play Therapy Podcast with Dr. Brenna Hicks, your source for centered and focused play therapy coaching.
Hi, I'm Dr. Brenna Hicks, the Kid Counselor. This is the Play Therapy Podcast, where you get a masterclass in child-centered play therapy and practical support and application for your work with children and their families. In today's episode, I am answering a question from Tess in Illinois, and this is specifically about coaching parents. We have been talking a lot about CPRT. I know I mentioned a couple episodes ago that we are launching the certification program with Corewell for CPRT training. Very excited about that. And for those of you that are already using CPRT, thank you for working with parents. We know that parents statistically have more impact as far as change in their families than we do. And that's meaningful to be able to take advantage of relationships and history and connections that are already there amongst parent and child versus trying to start from scratch with the therapist and child. So Tess's question is about working with parents who have disorders, and therefore it makes it a little bit difficult to teach CCPT skills to them. So I'll read parts of her email and then we'll dive in together. I've noticed that several parents I'm working with have personality disorders, either borderline or narcissistic. I'm finding it difficult to effectively teach these parents CCPT parenting skills, say that fast, when they struggle with insight or providing unconditional positive regard to their children. I would appreciate any thoughts. All right, Tess, thank you for this. One of the things that we need to start off with from the very beginning is vetting our CPRT parents. And really what that means, practically speaking, is not every parent is the right fit. Just like not every family and/or child is the right fit for CCPT. And I mean, almost always kids are the right fit for CCPT, but often the circumstances or the parent's dynamic or the parent's personalities or whatever. You know, if a parent says, I want you to take care of this in 4 weeks, that's not congruent with CCPT. If a parent says, you need to fix my child, this is 100% my child's problem and you need to fix them, that is not adherent to CCPT. So we recognize that sometimes we have to either say, I'm not sure that this is the right fit, or we have discussions to where we can get to a point where we're all on the same page, at least, that we think that this is a viable option. Even if it's not necessarily an easy fit, but we can all get on the same page with it. So specifically with the vetting of parents, one of the things that is important to keep in mind, there has to be a cognitive capacity for the parent to actually learn and integrate skills. I worked with a stroke victim in CPRT once, and she, because of her stroke, she could not remember things. And about halfway through CPRT, I realized even though she really is trying hard and she's taking all these notes and she really wants to learn this stuff, her brain will not allow her to remember it post-stroke. I had another parent I worked with that had a traumatic brain injury, and she had working memory and cognitive delays because of it. And she struggled mightily with CPRT, not because she didn't want to learn it, not because it didn't matter, not because she took it flippantly. Her brain just really was not able to make sense of the information that she was learning. So this would apply in a grand scale to personality disorders as well. Certain types of parents, because of language barriers, because of cognitive delays, because of disorders, because of whatever, you name it, fill in the blank, they're going to have a more difficult time than others integrating CPRT knowledge. It's not to say that it's impossible. It's just, it's going to be a different process, sometimes a harder process. We need to think through that before we start working with parents. Typically, there are certain personalities of parents that are very well suited for CPRT. And then there are certain personalities of parents that don't seem to be the most ideal fit. It doesn't mean that it can't work with anyone. It just means that we have to be considerate of where the difficulties might be, what obstacles we might be up against, and therefore how to address those. So Tess, when you're mentioning borderline and narcissism, those are issues that are going to get in the way of them being able to focus on relationship with their children. That's the whole premise of CPRT. That's why it's called child-parent relationship. The whole notion is that you're working to create a different relationship with your children. And with borderline and narcissism, they're going to struggle relationally. It's not to say it doesn't have any influence. It's not to say it can't work. It may just not move the needle as far. And another consideration is we have to be really patient. We are sometimes expecting parents to rewire their entire brains. In other words, they have to think differently, speak differently, respond differently, understand differently, communicate differently, basically undo everything they've ever done. And this is not a quick process. This is not an easy fix. And 10 weeks is actually very short. So sometimes we don't even see a whole lot of evidence in that 10-week curriculum that parents are really getting it, that they're actually able to integrate these. We usually see small changes. Sometimes we see monumental changes, but often it's slow. And think about it. We know that the average for children is 30 to 40 weeks. If we're only meeting with a parent 10 times, we wouldn't expect a child to monumentally change in 10 weeks in the playroom. So therefore, we have to have realistic expectations of timeline for them. Sometimes they're going to have longer before this sinks in and before they're able to actually really consistently integrate this new knowledge that they're learning. They have to basically start over from scratch a lot of the times. So even with something like borderline or narcissism, that can certainly be a hindrance. But it's also sometimes just being patient, because if they really truly want a relationship with their children, they really truly want to change, they want the outcome to be different, it might be really slow, but it doesn't mean that it won't happen. We typically encourage parents to continue doing play sessions long after that 10-week curriculum. Why? Because the child's only had 7 play sessions at the end of that 10-week window. 7 play sessions, that's a fraction of what kids need. And as long as parents remain consistent and they continue to do that 30-minute special playtime, parents continue to change, child continues to change, relationship continues to change. That's the goal. As far as those specific disorders, Tess, so borderline and narcissism, I would certainly advocate that they are in therapy themselves. So you might want to have that discussion and see, what their receptivity is to whether or not they are in therapy or whether they would consider therapy. You also sometimes have to help parents understand that this is not a unilateral change process. In other words, the child is not the only one changing. The parent is not the only one changing. It is from all ends. So as the parent changes, it forces the child to change. As the child changes, it forces the parent to change. As each one of those members change, it causes the relationship to change. As the relationship changes, the family dynamic changes, and so on and so on. So often it's helping parents see the bigger picture. This isn't just you have to do all kinds of parenting work. This isn't just your child needs to develop all kinds of self-regulation and self-control and emotional vocabulary. It's collaborative effort where everyone is working toward the common goal of increase in relationship that is healthy, because everything flows out of a healthy relationship. Borderline and narcissism are a hindrance to healthy relationships, and therefore they are sometimes going to have a harder road, but it's not impossible. And I think it's about being very clear. Clear is kind, honest is kind. We have to have clear and honest conversations sometimes. And sometimes those conversations are not easy, but we're always advocating on behalf of the child and the child's family. If they know, like, and trust you, they will understand why you're bringing up difficult topics and having difficult conversations. So often you might have to say, I understand that this is probably a little bit challenging for you, and let's process that together. CPRT is a lot of parent discussion. Yes, there's curriculum, but sometimes it's just the parent and you talking about life and you providing support and encouragement and feedback, because yes, they need to know skills, but they also need someone to walk alongside them and help and guide. And that's our role as a CPRT facilitator. So Tess, thank you so much for the question. I hope that that is helpful. For those of you who have never used CPRT as a parent coaching curriculum, if you are fully adherent to child-centered play therapy and it is all you provide, CPRT is an incredible avenue for providing parent coaching in addition to your work with children. So I would highly recommend looking into that if you have no background in that. And for those of you that are familiar, you know the outcomes and you've seen what it does for families. And that's one of my favorite things. CPRT is not easy to facilitate, but the outcomes speak for themselves. And when you watch transformation in families and in relationships between a parent and child, and you see how different their play sessions are over the course of the training, it's so encouraging and rewarding. So really a special additional suite of service that you can offer. All right. Love y'all. If you want to reach out, please do. Brenna@thekidcounselor.com. We'll talk again soon. Bye.
Thank you for listening to the Play Therapy Podcast with Dr. Brenna Hicks. For more episodes and resources, please go to www.playtherapypodcast.com.